No woman ever thinks she's the one who's going to get hurt by her partner.
Or forced to do something sexual she didn't want to do.
Or have him try to get her pregnant when she doesn't want to be.
So my doctor asked me if maybe he was breaking the condoms on purpose.
Or hiding my pills.
They gave me this card.
And I found out that there's a birth control method that he can't mess with.
Now about 10 years ago, when I was working in a confidential teen clinic in a youth agency in Boston, I had a 15-year-old girl come in for a pregnancy test, which is pretty routine adolescent medicine. Her pregnancy test was negative. I swung around and I said, so your test is negative. What are you using for birth control? And she said nothing. And I said, oh, well, here are all of your options. And very quickly I assumed that she just needed to be educated on the different types of contraceptive options. Somewhere along the way, I asked her about whether she felt safe in her relationship and whether her partner would use a condom. And I got sort of a shrug and a whatever. I handed her a brown bag full of condoms and said to her, now you come back any Thursday night when I'm here so we can talk about what birth control is right for you. And 2 weeks later, she was in our emergency room with a severe head injury, having been pushed down the stairs by her boyfriend. And I have to say, every time I tell that story, I get the chills up and down my spine because it was by far the most destabilizing experience as a clinician. I had actually done work on training healthcare providers on domestic violence prior to that and really thought I knew how to identify domestic violence in the clinical setting. And what I missed that evening were multiple red flags, including a young woman who was not using birth control, and how quickly as a clinician I assumed that it was a knowledge deficit as opposed to the possibility that her partner might have been interfering with her ability to contracept.
What we really know overall is that now, in terms of relationship violence and intimate partner violence, the warning signs are not necessarily just a bruise, a broken limb, other visits to the emergency room. The warning sign could, in many cases, be a pregnancy. Or, alternatively, it could be abortion, repeat abortion. It could be repeat STD testings. It could be an STD. In that way, reproductive coercion is really the most secretive, stealthy, possibly even in certain ways the most life-altering type of domestic violence.